community water fluorination in Manatee County. Commissioner Ballard, you are up.
Thank you very much. So in bringing this item, I did actually find out yesterday, I'm just going to preface this, that our fluoridation system in the county has been broken since 2021. So fluoride has not been actively added to our water system since 2021. So we apparently still have levels that are about 0.2, and according to staff, those are just background levels that are naturally present in the water. But that being said, I think it's still an important discussion to have. The ordinance that we currently have says that we have to add fluoride unless the board directs otherwise. So we still need to have the discussion and have a vote. So I'm going to just read out my kind of thoughts, and then we can move to commissioner discussion. So prior to 1991, Manatee County didn't have fluoridated water. In 1991, ordinance was passed adding fluoride to the community's drinking water. It was popular, it was growing all over the country, and we didn't have knowledge of potential risks of fluoridation. And we can say that fluoride at 0.7 milligrams per liter does reduce the risk of cavities. And that was the level that we were fluoridating at. And there are dentists and there are fluoride lobbying groups who would like you to kind of stop your inquiry right there. But at this time, there's too much evidence that tap water fluoridation unacceptably increases the risk of neuropsychiatric disorders like ADHD and lowers the IQ of our children. And we saw during COVID the risks of policymakers listening to only one group of public health experts at the exclusion of other evidence. And that shouldn't be happening in Manatee County. We have meta-analysis from the government, a rigorous 9-year research review looking at the relationship between fluoride and intelligence levels in children, concludes that as fluoride levels rise, IQ drops. Every 1 part per million increase in fluoride in the urine, a way of measuring all sources of fluoride that a person is consuming, was associated with a 1 point drop in a child's IQ score. That review concluded. That study began in 2015. It was published in 2024. It's a comprehensive review of 74 different studies over a decade. So that's significant high-quality research. So a 5-point decrease in a population's IQ would nearly double the number of people classified as intellectually disabled in a population, they wrote in their conclusions. That was released in August of this year. In September, a federal judge ruled ordering the EPA to further regulate fluoride to protect children's intellectual development. In a statement, going back to the study authors, they said that they actually didn't have enough data to know whether the level of fluoride that's recommended currently for drinking water has any effect. So at the time that our community began fluoridation, the risks of the compounding levels from our water, our toothpaste, mouthwashes, and our diets were unknown. People receive fluoride from dietary sources like grapes, raisins, shellfish, chicken, tea, coffee, oatmeal, spinach, carrots, potatoes, and rice. With those 3 different sources of constant fluoride intake, it's probable that a lot of people in our population are receiving unsafe levels of fluoride. Less likely now that we know our fluoridation system is broken, but still possible. And we don't know what level is safe for our children's brain development. The U.S. is one of the only countries, especially in the developed world, that fluoridates its water. And more U.S. residents drink fluoridated water than the rest of the world combined. The only other developed countries with high adoption of fluoridation are Australia, Canada, and Ireland. So it costs on average $1.23 per citizen per year for fluoridation. So we're spending over $500,000 a year to put an additive in our water, which could be causing lifelong harm and developmental disabilities in our children. Currently, if we want to replace the fluoridation system, I think our staff has some numbers on that. If there is a group in the county that would like to apply for children's services funding to provide free fluoride treatments to at-risk children whose families sign up for that kind of program, I'd be in favor of that because that would be a choice. But fluoridating our entire water system without residents' choice, I'm not in favor of, and I think we need to pass an ordinance to ensure that it is stopped. Thank you.
All right.